Being injured or ill is very stressful at the best of times, but government policies are making it much, much worse. We're here today to find out what the people's experiences are with the NHS. Let's go and find out. How do you think the NHS is doing compared to how it used to be?
Not as good.
Not as good?
No.
Can you tell me why?
Waiting times are longer.
Well, it's terrible at the moment.
Right.
Yeah.
Can you tell me a bit about that? Why do you think?
Well, it's the people having to wait.
So-
On when they come on the ambulance and the trolleys out, when they're in the hallway, waiting to go to be seen.
Not as good.
Not as good. Well, why would you say that?
Well, my husband was, he had cancer for years,
Yeah.
and things weren't the same. You had to wait a long time,
Okay.
for things to go. But they did a good job, you know what I mean?
Yeah.
Which is the waiting and everything.
Well, my mother had to wait quite a long time with a chronic chest condition that,
Yeah.
which probably actually led to passing away, in the long term,
Yeah.
Well, it just doesn't seem to be run as well. The waiting list seems to be a lot longer. My experience has been okay with it, but I know a lot of people have a lot of problems. A lot of operations have been cancelled, but there's more people using it,
Yeah.
and there's more people using it because they're probably not putting into it. That's my
right.
opinion.
What about health tourists coming over? Do you think they should be banned?
Yes. Yeah,
Definitely.
I do, because I think they're fetching a lot of stuff in this country.
Yeah.
Yeah.
A lot of people have said that today.
Yeah.
A hell of a lot of people have said that today. Do you think immigration has put a strain on the NHS, so many people?
Well, I think so, because a lot of them that are coming in this country, they're getting it free, whereas we've had to work for this.
Yeah.
Yeah.
Because why should they get to come over here and have our free healthcare, which we pay for, on national insurance?
Okay, next question. Do you think the immigration crisis has put a strain on the NHS?
Yeah.
More people?
Definitely.
Yeah, definitely. Okay.
They should be made to pay.
Yeah.
Because if you go abroad and you have an operation,
You've got to pay.
you'll have to pay.
Whatever the price is, that's what they should pay.
Yeah.
If they can't pay it, then they go somewhere else.
Well, the NHS, nobody should be entitled to healthcare unless they've paid into the system, and those are the rules that exist now. I think following up the rules and enforcing them is quite difficult, and realistically, no A&E service is going to turn away somebody who's, this isn't America where it's show your insurance first. Nobody's going to turn somebody away.
These people coming in,
shouldn't get anything unless they've been here so long or pay to it.
we've paid all our lives for it,
Yeah.
and they're getting priority really over us.
Do you think that's putting a strain on the NHS?
Yeah.
Yeah, definitely.
Finally, do you think that it's a serious position now where it could collapse?
I think so, yeah.
Massively straining the system, and nobody wants to sit down and listen to that or actually believe it.
Yeah.
And I'm not racist or discriminatory against people, but it's causing a major problem because a lot of people that are coming into the country are not necessarily coming just for an operation. They've got major health problems that are leading to what they need doing, and therefore it's not just as simple as a little bit of an operation. They then need lots more care, medication and treatment.
Well, that's fantastic. Do you think it's so serious now that the NHS one day could collapse?
Absolutely, and I don't think it's that far off.
I think it might be that the government wants it to collapse to privatise it.
Yeah, there's a few people that have said that today.
Very sorry.
Yeah, no,
She's absolutely right.
Yeah.
It's semi-privatised now.
And that's
Quite a
caused
bit of it is,
part of the problem.
And the more they can hive off, the better.
Right.
For them, and worse for us.
So, the word on the street is that all the constant immigration has overloaded the NHS.